So the next topic that I'm going to talk about today is insulin delivery. The learning objectives for this segment are: name 3 advantages for using insulin pens versus syringe, describe the steps to ensure accuracy of dose when using an insulin pen, identify lipohypertrophy and recognize the importance of injection site rotation, and list 3 advantages of pump therapy. So there really are 3 ways for people at home to deliver insulin. One is through a vial and syringe. I suspect you are all pretty familiar with that approach. And some people do still use vial and syringe. Much of it depends on medical insurance coverage. There are a few people who feel better using a syringe and vial. It's what they learned and it's what they feel comfortable with. Most of our patients are now using insulin pens. I think that some of the advantages to using the insulin pen is that they can be, when used properly, more accurate than using a vial and syringe. They also can provide some discretion when people eat out in restaurants. They also provide a more frequent turnover of the insulin. So in an insulin pen cartridge, there are 300 units versus 1,000 units that is in each of the insulin vials. So people tend to start new insulin more often. It is important to let patients know that it is okay to keep their insulin at room temperature. If they have extra insulin, certainly store that in the refrigerator, but the insulin that they are currently using is okay at room temperature. Many times patients will leave their insulin at home rather than bringing it with them to a restaurant because they're afraid of having it out of the refrigerator, and that can cause them to miss doses. I am going to show you a couple of the different pens on the market in a couple of minutes, and I'll show you how someone would give an injection using that insulin pen. So next we're going to talk about insulin pump therapy. Insulin pump therapy does provide some advantages. The insulin pump really is just a reservoir of insulin that is driven by a pump into an infusion set and is controlled by the patient. So the insulin pump will deliver a basal insulin, and this can be set very precisely to accommodate the patient's diurnal patterns and insulin needs, much better than we can do with injected insulin. So that is set and is delivered continuously. The bolus insulin is controlled by the patient. So then the pump becomes a calculator, where the patient has to let the pump know what the blood sugar is, how many grams of carbohydrates they're going to eat, and the pump will calculate, based on pre-programmed ratios and calculations, how much insulin is needed. What's also nice is that the pumps nowadays will keep track of doses that are still out there. So assuming that a dose of Humalog, Novolog, Apidra, rapid-acting insulin will last about 4 hours, this can be programmed so that the pump remembers when the last dose was. This helps patients to prevent stacking insulin and causing hypoglycemia. So some of the reasons that people like to wear pumps is that it can be more convenient. They can probably get better blood sugar control just because of the precision of the basal insulin dosing, the precision of the bolus dosing, and also because of the convenience. So they're less likely to miss injections. It's easier to give multiple injections at buffets or times when they eat out when they don't really know what they're going to have in their entire meal. Certainly there are some disadvantages to wearing the pump. They are expensive. Most insurance companies will cover an insulin pump, but they do require ongoing supplies, and we encourage patients to also have a backup to be able to give themselves insulin if for some reason the pump fails or something happens to the infusion set. So there are really 3 pieces that are required for the insulin pump. One is the infusion set itself. Then there is a tubing that leads to a reservoir that patients fill with insulin, and then the pump itself. There's also an increased risk of ketones when patients are on a pump. And the reason for that is that if there is some problem with the pump, in other words, a pump failure, if there's a problem with the insulin delivery into the infusion set, or a problem with the infusion sets are generally little plastic catheters that sit underneath the skin. You can't see them once they're under the skin, and if they become crimped or bent, the insulin delivery can be interrupted, and this can lead to a lack of insulin, which would be the reason that people would sometimes develop ketones, and the wearer would not know that they had that crimp and that they were not getting the insulin until their blood sugars were not responding to the insulin itself. So there's a great deal more of problem solving that goes into trying to figure out what is wrong when a blood sugar rises, and whether it has to do with the pump, if it has to do with the wrong dose, the wrong carbohydrate count, illnesses and stress. So people who are on pumps don't have that chunk of insulin that sits underneath the skin and delivers the insulin to them continuously throughout a 24-hour period. People on pumps can actually develop ketones really quite rapidly. So just to review, why would somebody develop ketones? It could be because the insulin's gone bad, could be that there's a problem with their pump, could be that for some reason they maybe even just forgot to put their pump on. They had a shower, they disconnected, they left the house and forgot to connect their pump. So I'm going to show you a couple of the different pumps that are available on the market. I think that it requires a fairly savvy patient to really take advantage of the options that a pump can allow, and an experienced provider to help to figure out what the settings on the pump should be. So the last thing I'm going to cover in this segment is lipohypertrophy. Many patients, because they do these injections so often, get into the habit of injecting into the same areas. This can cause scarring kind of fatty tissue to develop, and insulin does not absorb very well in these areas. So you can see on this picture that in these areas here is where this person has been doing their injections, and so it really can cause some kind of swelling to occur. Those are areas that the insulin probably won't absorb very well. So if you have patients who don't seem to be responding well to the insulin, that you're increasing the doses but not really seeing big changes in their blood sugars, that would be the thing to look for. We've gotten into the habit of looking at injection sites at every visit, and you'll be surprised what you find. It's really not that hard to recognize when it's happening, and it's a really simple way to improve blood sugars pretty rapidly. And so now let's take a look at some of the injection delivery systems, including the pens and the insulin pumps. All right, so as I mentioned, I'd like to show you some of these insulin delivery devices. So the first is the vial and syringe. Everybody has seen that, no mystery there. The next thing I'm going to show you are the insulin pumps, and then we're going to move to the insulin pens. So this is just a smattering of 3 of the different pumps that are available out there. There are several others that are also available. So this is the Medtronic version. It is the one that can be integrated with the CGM. And how this works is that a syringe is filled with insulin by the wearer. That syringe is dropped into the pump. The tubing then delivers the insulin into the infusion set that the user also inserts into their skin. So every 3 days, that system is changed out and a new set of insulin and insulin set are put in. So now we're going to look at the insulin pens. There are a couple of different insulin pens. Some are durable, where the cartridge is disposed of, but the pen is not, and the others are disposable. So let's look at the durable pen first. When the patient picks up their prescription from the pharmacy, they will get 5 cartridges of insulin. In this case, this would be Humalog. Generally, all of these cartridges are kept in the refrigerator until the patient uses one. The pen comes apart here, and the cartridge goes inside. Attached to that, then, is a pen needle. So there's a paper back, and that just screws together. What's nice about these durable pens is that they can dial in half-unit dosing. And for people who are on very small doses of insulin, that can be helpful. That could be someone who has been newly diagnosed with type 1 diabetes who is still making some insulin. Or it could be someone who has had diabetes for a very long time who really doesn't need much insulin. So you can see that that's the pen with the needle on it. Because it's a mechanical device, we teach the patients to do an air test before every dose to make sure that there is insulin flowing and that the insulin pen needle is primed. In order to dial the dose, I'm just going to dial on the bottom here a couple of units. Then with the pen upright, I'm going to push on the plunger end. I want to see some insulin coming out of that needle. So we teach our patients 3 drops. That was 1.5, so let's do that again. 2 more units. We want to see at least 3 drops of insulin. So that's a successful air test. We know that this pen's going to work. Now we can dial our dose. If you listen to the clicks, you can hear how much insulin you're dialing. This is very helpful for people who have visual impairments, who can't see a syringe, or who have dexterity problems. So if you listen, each click is 1/2 of a unit. So I can count the clicks, but I can also look to see how many units I have. So I should have 2 units. We inject at a 90-degree angle, straight in to the skin. Push down on the plunger end. That brings us back to 0. Then we count to 10. And the reason that we count to 10 is that the insulin pens deliver the insulin a little bit slower than a syringe does, and we don't want that insulin to leak from the site. So after we've counted to 10, we can pull the needle out, we can cap that needle and remove it. So that pen is now ready to go for the next meal. The disposable pens work much the same way. The pharmacy will provide these in a 5-pen pack. So 4 pens go in the fridge. One that you're using is okay at room temperature for a month. Taking the lid off of that, the needle goes on the very same way. Two caps. Again, we're going to dial to make sure that the pen is working. This is the air shot, 2 units. And now remember that this pen is dialing in 1 unit increments. So each click on this pen is 1 unit. So pushing on the plunger, I want to see those 3 drops, and I do. Then I can dial my dose. So that's 1, 2, 3, 4 units. Same thing, 90 degrees. Push the insulin in. That brings us back to 0. We count to 10, and we pull the needle out. That is how the insulin pens work. It's important to use them correctly because you can get incorrect dosing if you don't follow all of the steps. People really appreciate using the pens because they're easy.